continue with the next topic, which is about government schemes and empanelment in private hospitals. How to get government schemes and get empanel and this is a very important topic, particularly for startup hospitals. Every government has the responsibility towards its citizen to provide affordable and accessible healthcare to whoever it needs. India is now the home of large number of hospitals and daycare centers, and in the past few years, the growth of the unicorns have been exponential. But the main problem for these hospitals is getting funds, particularly in the initial stage. So to help these hospitals, the government of India has decided to roll out several schemes that finances and further promotes these, and also so that the common citizen can also avail these facilities whenever they need the most. Now, what is a government health scheme? A government health insurance scheme is actually an insurance policy which is sponsored by the state or the central government with the aim of offering affordable health insurance facility to the different stratas of the society. The list of such schemes are endless, but the one which is applicable to ophthalmology are the Ayushman Bharat scheme, Central Government Health Insurance Scheme or CGHS, Employees State Insurance Scheme or ESI, National Program of Control of Blindness. A very popular scheme these days is the Ayushman Bharat scheme, and this was launched in 23rd September 2018, and it is designed to unify the segmented health sector in India. It has two components, the Pradhan Mantri Jan Arogya Yojana or the PMJAY and the Health and the Wellness Center. Features of PMJAY is that it is an insurance scheme that offers a sum assured of 5 lakhs per family, and there is no limit to the family size. It converges with the central and state health insurance scheme, keeping in alliance with the state schemes. National Program of Control of Blindness has been functioning since 1976, and it is a 100% centrally sponsored program. It was started to reduce the prevalence of blindness from 1.4% to 0.3% by 2020. However, in 1994 and 95, it got decentralized with the formation of District Blindness Control Society in each district. The central government health scheme was started under the Ministry of Health and Family Welfare in 1954. The objective of this scheme was to provide comprehensive medical care facility to central government employees, pensioners, and their dependents residing in CGHS covered cities. The beneficiaries under this scheme are allowed to undergo treatment at any hospital, both government as well as private hospitals, which are empaneled under CGHS for any specific treatment procedures listed under their list. The ESI or the Employment State Insurance Scheme is actually a self-financing social security and health insurance scheme, and it's a social welfare act enacted with the view of providing certain benefits among the workers. The benefits include maternity benefit, sickness benefits, medical and dependent benefit, and disablement benefit. Knowing about these, now how are these government schemes beneficial for the patient? These government schemes, they are offered at a very low price, and so BPL families can also avail the insurance benefits, and they include treatment in both private and government hospitals. How are they beneficial to the hospital is the next question. For that, we have to understand the concept of empanelment. Empanelment is actually an act of assigning each patient to a primary care provider who, with support of the care team, assumes responsibility for coordinating comprehensive services for his or her panel of patients. They have multiple benefits to any medical practitioner practice, and they usually run through a provider network, which includes a third-party administrator, which is the connecting link between the insurance company and the patients, the insurance companies, the government agencies like CGHS, ESI, etc., and corporate tie-ups for health checkups. Of the different benefits that the hospital gets out of empanelment, is one of the biggest benefit is to increase the coverage of the patient base. Hospital usually gets more patients through the health insurance company's network, and they have a direct access to these patients through, and it also gives credibility to your practice, because the empanelment procedure, it comes through a process of verification, and the patients, they perceive it as a recognition, particularly for the government empanelment, and it's a brand building exercise for your practice. Coming to the procedure of empanelment, there are certain guidelines which are set by the Ministry of Health and Family Welfare or any other governing bodies. It starts with submitting a letter requesting them, providing all the details of the facilities that you have, and filling up the performa which is attached. This is followed by assessment, which is done by the government official or the board of members of the company. Once they are satisfied with all the facilities that you have in your hospital, they put the name of the hospital under the empanelment list. There are 4 categories of hospital empanelment: network hospital, non-network hospital, preferred network hospitals, and agreed network hospitals. Network hospitals are the one which has a direct tie-up with the insurance company, and they provide cashless facility. Non-network hospitals are those who do not, where the card of insurance policy will not work. The patient has to bear the expenses, and later on the hospital gets, the person gets the amount reimbursed from the insurance company. The preferred network hospital has special tie-ups with the insurance company, and they give you discounts, and there are other features also. Agreed network hospitals are somewhat similar to preferred network hospitals. There are certain shortcomings also. The procedure itself is very long and tiring. It involves a lot of paperwork, is often delayed in the payment. It sometimes takes months and maybe close to a year for the hospital to get the amount reimbursed, and you always need a separate unit to manage with the official formalities and keep communicating with the agencies. So to conclude, India's health insurance market is anticipated to register a robust CAGR of 29% during 2021 to 25, owing to expanding middle class population, growing awareness about benefits offered by the health insurance plan, favorable government initiative, and growing expenditure of healthcare. The trend now is that more than 50% of the middle or the higher class patient, they come under one or the other panel. So getting empanelment has now become a necessity for any hospital, or the hospital will be losing a lot of potential patients. Thank you so much.
Thank you, NILAKSHI.
So since Dr. Jayanta Kumar Das is, we'll discuss. If there's any question from the audience, you can please ask us.
I'd like to just want to discuss with you. Is it imperative that you go for empanelment? Is it necessary to go for empanelment for a hospital always?
Sir, it's not that imperative, but seeing the economic growth of India now, most of the people, they opt for cashless treatment. So to survive and to sustain, I think the hospital should apply for empanelment. In the long run, it will be beneficial for the hospital.
Do you need to, how do you, after empanelment, do you need to have any special manpower for managing empanelment and managing the paperwork for this?
If yes, of course, that depends on the number of empanel cases that you're getting. If the number is quite less, then you yourself can manage with the paperwork. But however, if the number keeps on increasing, definitely we need a separate unit or a separate people who are engaged in these empanel works, because they are quite time consuming and won't be possible for clinicians to manage both the OPDs and all the paperworks.